Okay, hi everyone. So now we have 4 lightning talks, which will run back to back. These are 5-minute talks from researchers working in the fields of global priorities research, including myself, Dylan Bowen, Daniel Bresler, and Tyler John. I hope you enjoy the talks.
So you got your academic affiliation and you want to do some research. You've read through GPI's research agenda and all the resources that affect your thesis. You've gone to a few EA global conferences, and you generally think you've got a pretty good sense of what the world's most important issues are and what open questions about them remain. Now you're trying to figure out what particular research questions to prioritize in your work. In this talk, I'm going to give you a framework for figuring out which research questions you should pursue. Let's start with the guiding aims of topic selection. What's the point of your research project anyway? Well, there are 3 main reasons to do global priorities research. The first is to increase the knowledge of cause prioritization researchers. We want to solve questions to help effective altruists, advocates, and foundations figure out what the most important issues are so that we know where to put our marginal resources. The second aim is to increase the knowledge of governments, activists, foundations, and other large actors to help them figure out how best to execute on their goals. And we also might want to persuade them of some principles that cause prioritization researchers already accept, so that they're better able to allocate their marginal resources. The third goal is to influence the values of the research community. By influencing the values of the research community, we can do 2 things. First, we can increase the capacity for global priorities research. If we persuade the academic research community that this research is cool and interesting and important, we can multiply our impact by getting other academic researchers to work on these questions. And second, we can shape the direction of academia's influence over the rest of the world. Academia influences future leaders and it also influences government. Moreover, academia appears to have an outsized effect on the shape and the direction of social movements. If we can persuade academics of a certain sort of normative or empirical outlook on the world, we can in turn have a massive indirect influence on everyone else. Now let's look at the features of the very best research projects. These projects should have the potential to achieve the aims of global priorities research that we just talked about. They should be useful. Second, they should be of interest to your field. The only way you're going to have your work published in top journals and have it taken seriously by your field is if you work on questions that your field has some interest in. Usually this means using the accepted methodology of your field to show some surprising new conclusion, or to challenge the accepted methodology of your field directly. Now this doesn't mean that you shouldn't write on weird things. It's very important for your work to be weird in some ways, otherwise it won't change anything. Third, the best research projects have the potential to blossom into a robust research agenda. One-paper projects can be good sometimes, but in general you want to pick a complex project that has lots of problems to solve. This can create capacity for your research area by opening up interesting avenues for other researchers to pick up on, but it also helps your career. Most academic hiring committees want to see that you have a research program that you can continue to develop, and having a coherent research narrative will also help you to create a public identity as a researcher, so people will know you as the person who works on that thing. Fourth, these projects should be achievable and of interest to you. Academic projects are lengthy and grueling and often last for many years. Make sure you work on a project that excites you, as this will make you much happier and a more productive researcher. One thing I want you to notice about this list is that it really amplifies the importance of neglectedness. Very neglected research projects will tend to be more valuable in many ways. They more easily blossom into a robust research agenda because there's so much new work to do. They're novel and therefore more exciting to academic researchers. And they'll also make you much more influential by making you the go-to person on your particular issue, allowing you to gain an audience with governments, advocates, and the public, and also letting you frame the basic terms of the debate. Now, choosing new and neglected research topics can seem high risk and intimidating, but the good news is that the growing Global Priorities Research Network can help mitigate this risk through funding, jobs, peer support, and signal boosting global priorities research. The recent growth of this network and our early time in its development makes now an unusually good time to begin a neglected and high-value global priorities research project. Thanks for listening, and please check out some of these further resources to learn more about global priorities research topic selection.
Hi everyone, my name is Bridget, and today I'm going to talk a bit about the intersection of global priorities research and health. So I'm a medical doctor specializing in public health medicine, but as I've progressed in my career, it's become increasingly clear just how important it is that we pick the right problems to work on, and how we determine our global health priorities is a relatively underexplored area. So I'm starting to direct my career towards answering this question of how can we best distribute resources to improve population health. So there's been work done in this area already, especially around the question of what healthcare services we should provide, particularly around what treatments or services should be part of universal health coverage. However, we know that healthcare services aren't the only way that we invest in health. So decisions about what public health interventions we should pursue, what health research we should fund, and which issues should be discussed in major political arenas are all questions of what our health priorities are, as is how we choose to distribute resources across these different types of interventions. So I'm not the only one who thinks that this is an interesting and important area to work on. So this is Zeke Emanuel, who's an American physician and ethicist, who here is reflecting on the lack of agreed upon ethical frameworks for priority setting in health. So as he says, the result is not pretty. It produces conflicts that are often resolved arbitrarily or by political power rather than principles. The result is resource allocation decisions that seem to violate basic ethical and economic principles. So there's a lot of interesting questions to work on in this area, but one that I find particularly interesting and that I think is underexplored is the question of how future people fit into our global health priorities. And I think that the current ways that we think about global health priority setting don't really take this into account all that well. So this picture is of the 1993 Investing in Health report, which has been hugely influential in how people think about global health priorities. And in it, they suggest that there's at least these two factors which we should consider for global health priorities. So the cost effectiveness of interventions that are available to address an issue, and also the disease burden caused by that issue, which is a measure of the scale of the problem. So for the rest of the talk today, I'm just going to concentrate on this question of scale and how that interacts with how we think or how we can bring future people into our health priorities. So many of you might be aware of this study called the Global Burden of Disease. So it aims to map out the state of humanity's health, so to quantify the amount of ill health that's caused by different problems or diseases. So it's hugely influential in health priorities. It's very common for people to refer to disease burden data when they're making the case that a certain area should be a priority. People often compare disease burden data to funding allocation decisions and suggest that if there's a mismatch, then that's a sign of inappropriate allocation. And also my home country of Australia has identified national health priority areas largely on the basis of disease burden estimates. So a question or a problem with this is that things change. So the state of our health doesn't stay the same. So for example, we know that it's likely that climate change will have an increasingly large impact on public health. Similarly, if there were to ever be a nuclear strike, that would have profound implications for population health. And all of us right now are painfully aware of the impact that a novel pandemic pathogen can have. So at this point, you might say, well, this is all well and good, but we can't predict the future. So perhaps just looking at the state of our current health and the relative scale of different health issues at the moment is the best that we can do. So I would push back on that a little bit and say that we're not completely clueless about the future. So for example, we didn't know that COVID-19 would happen, but we did know that it was really likely that there would be another large-scale pandemic. So this is a picture of Debbie Schreeder and Bill Gates, both discussing the importance of pandemic preparedness in recent years. And so many people, or you could think of COVID-19 as a once-in-a-century pandemic. So if we were thinking about questions of scale of the different health issues facing humanity in terms of decades or even centuries, then something like this would have loomed a lot larger before now. So what does this mean? So I think that this means that we need to reconsider how we use scale as an input into our health priorities and perhaps have some more nuance. So to not just take our current disease burden estimates as a blueprint of what our health priorities should be. And I also think it means that we should be considering if we can take a prospective approach to disease burden. So obviously this would have big technical challenges, would require advances in modeling and forecasting, and it also raises important ethical questions like the relative value of health in the future to health in people today, to people's health today, and the nature of our obligations to future people and current people. So these are really big questions which I can't cover in 5 minutes, but if you found these sorts of questions interesting and you found what I've talked about interesting, there are some resources that you might want to have a look at, and I'd also love to hear from you if you're interested in exploring this area further. Thank you.
If you're listening to this talk, it's probably because you care about making a difference in the world, not just today, but 10, 100, 1,000 years from now. The problem is that it's tough to anticipate how the actions we take today are going to affect the future. In 1787, the founding fathers of the United States couldn't agree on whether states should have proportional or equal representation in government. They settled on what seemed like a great compromise: a proportional House, equal Senate, the Electoral College. Back then, the smallest and largest states' populations were separated by one order of magnitude. Today, it's 2 orders of magnitude, and as a result, 2 of the last 3 US presidents were first elected in spite of the popular vote. If the founders could have anticipated how their actions would affect the world more than 200 years later, would they have chosen a different course of action? Our situation isn't so different from the founders. There's some dissimilarities, of course. We're not creating a country, but we are a group of intelligent, hardworking, capable people. The helm of the world is in our hands, and it's critical to anticipate where we're headed. How will our actions today affect the future of developing nations, the Earth's climate, technological progress? But prediction is difficult, especially if it's about the future. My advisor studied forecasts made by hundreds of experts in political science and economics to see if they could anticipate how geopolitical events would unfold. His conclusion? The experts were no better than dart-throwing chimps. Time for some good news. There are people who can forecast the future. For the last year, I've worked with a team of them to win a forecasting tournament sponsored by the US intelligence community. We did it through a combination of mathematical literacy, geopolitical awareness, grit, and good epistemic hygiene, and of course, the crystal ball. Time for more good news. There's a lot of room to improve. The super forecasters I work with are numerate, but they're not statisticians. They're politically aware, but they're not policy wonks. They work hard, but forecasting is their hobby, not their vocation. How much better could we do if forecasters train like Olympic athletes? Another way we can be better forecasters is by incorporating machine learning into our workflow. If human-computer hybrids could dominate the world of chess for 2 decades, imagine what human-computer prediction systems could do for the world of forecasting. Right now, these cyborg systems are in their early stages, mostly limited to algorithms for aggregating predictions for multiple forecasters. Recent advances in forecasting software use Monte Carlo simulations to string together multiple forecasts into simple networks. On the horizon are algorithms to automatically correct for biases and overconfidence, complex Bayesian networks, entirely new programming languages dedicated to forecasting. So, what can you do if you want to become a super forecaster? First, make forecasts. Check out platforms like the Good Judgment Open, Metaculus, 80,000 Hours Calibration Training app. Challenge yourself to get better over time. Second, read up on forecasting techniques. Start with books and interviews by Philip Tetlock. Third, put forecasting into practice. If you don't know whether to start a new project, forecast how long it will take and its probability of success. If you don't know whether to switch jobs, forecast what your career will look like if you stay and if you go. If you don't know which existential risk to mitigate, forecast the probability of catastrophic events. The better we can anticipate the consequences of our actions, the better decisions we'll make, and the better the world will be in 10, 100, 1,000 years from now. Thank you.
Hi, my name's R. Daniel Bressler. I'm a 4th-year PhD candidate at Columbia University. I'm also a Forethought Fellow at the Global Priorities Institute, and I'm here to do a 5-minute lightning talk on my recent paper, The Mortality Cost of Carbon. So this is a long working paper, 40-plus pages of single-spaced stuff that you can read about at Columbia's Center for Environmental Economics and Policy website. But here I'm just going to give you a little bit of motivation, some of the high-level takeaways, and the rest you'll have to read about. You can find the paper at that link right there. So to begin, climate change is expected to have a big effect on human mortality over the course of the 21st century. A 2009 Lancet report concluded that climate change is the biggest global health threat of the 21st century. There have been hundreds of recent scholarly papers that have suggested that global warming is likely to have significant human mortality effects. However, the effects of climate change on human mortality have largely been left out of the DICE integrated assessment model that was created by Nobel Prize winning economist William Nordhaus. So this model projects optimal climate policy by comparing the benefits of reducing emissions with the costs of decarbonizing the economy. It's been highly influential in policy, and it's informed trillions of dollars in regulations. So it's important that its output includes the latest scientific understanding of the effect that climate change is expected to have on human society broadly, including mortality. So in this paper, I create an extension to DICE called DICE EMR, which stands for DICE with an endogenous mortality response. So DICE EMR takes the rest of DICE as given, but it adds a new component that estimates the effect that climate change is expected to have on human mortality. And I do this through a systematic research synthesis of the peer-reviewed literature. You can read about it in detail in the working paper. So this model revises the optimal climate policy, and it calculates a new social cost of carbon such that the effect of global warming on human mortality is included in both of those metrics. So the revisions to optimal climate policy are quite significant, and you can read about them in the paper. But in this particular talk, I'm just going to talk about the second key thing that I did, which is DICE EMR also projects the number of excess deaths due to climate change using estimates from projections made in the peer review literature. So one number we might be interested in is the total number of excess deaths caused by climate change. And that's shown right here, cutting right to the chase. In a baseline emissions scenario that leads to just over 4 degrees warming by the end of the century, there are 89 million excess deaths caused by climate change in the central estimate of DICE EMR. And again, that's through the pathways through which the peer-reviewed literature has made projections. So while this number is interesting, I'd actually argue it's not the most useful metric to inform decision-making. Let me explain why. It represents the total mortality effect from climate change that results from all global economic activity in aggregate across time from the beginning of the Industrial Revolution all the way to 2100. So the emissions decisions of any individual person or organization or even a country are going to be quite marginal compared to the total global effect across time. So what is useful for determining decision-making is the marginal effect, i.e. as an individual or an organization or a country at a specific point in time. If you increase or decrease your emissions, how many excess deaths will you cause or how many lives will you save? So that's where the mortality cost of carbon comes in. And that's a metric I introduce in this paper. So that is defined as the expected excess deaths globally from 2020 to 2100 caused by the emission of 1 additional metric ton of carbon dioxide equivalent emissions in 2020. So cutting straight to the chase, what is the mortality cost of carbon? Well, in the central estimate, it's 2.35 times 10 to the negative 4th excess deaths per metric ton. So when I first calculated that, didn't really have good intuition for what exactly that meant. Was it big? Was it small? I didn't really know. So I converted it to something I could understand. So it implies that 4,262 metric tons of 2020 emissions caused 1 excess death from 2020 to 2100. So 4,262 metric tons, that's equivalent to the current lifetime emissions of 3.3 average Americans. So if you take the current lifetime emissions of 3.3 average Americans, you release them into the atmosphere in 2020, this will cause 1 excess death globally in expectation between 2020 and 2100, again, through the pathways that the peer-reviewed literature has made projections for. So this is a surprisingly large effect. This marginal effect is surprisingly large compared to the total effect. So the reasons for this are discussed in the paper. It's primarily because of the mortality response to warming is highly nonlinear. You can read a lot more about that in the paper. From a global priorities perspective, though, I'd argue that this metric is actually useful if you want to compare the number of lives that you can save from an intervention that causes a marginal reduction in carbon emissions versus, for instance, charities recommended by GiveWell that improve health in the developing world through interventions like deworming or providing mosquito nets for malaria. So I'll just close on a larger point here, which is that I think that combining a global priorities mindset with well-established methods already used in an established field. So in my case, this is integrated assessment modeling, which is used in environmental economics. In my view, this is a good way to get interesting new results. So you use methodologies that are already well developed, and you approach them in a slightly different way, motivated by global priorities, and you can get interesting results. And I think that in this particular case, these results, they're interesting to people both in effective altruism and outside of effective altruism. We look at the effect of marginal emissions on excess deaths. So if you're an individual, an organization, or even a country, and you want to know the effect that your emissions and your emissions decisions have on excess warming or excess deaths because of global warming in the future, this is an interesting metric. So thank you, and hope you enjoyed the presentation.